Ladies and gentlemen, dear colleagues, good afternoon, and please welcome to today's webinar discussing about leadership and the need for strong and unified public health workforce. This webinar is a joint event of the European Public Health Association and the Association of Schools of Public Health in the European region, the ASPHER. Our invitation to join the discussion also kindly accepted representatives of the European Public Health Alliance, the WHO Europe, and the European Commission. My name is Iveta Nagyova, and I'm the president of the EUPHA, the European Public Health Association. And I have a great pleasure to welcome here today also my co-presenter and co-chair, John Middleton, the president of the ASPHER. John, please.
Thank you very much, Iveta. It's also my great pleasure to be here today. The long relationship that EUPHA and ASPHER have shared, it's a long road, but it's a new landmark for us. And I look forward to hearing what colleagues have to say as we move into this session. Thank you.
Thank you very much, John. Yes, you absolutely perfectly started my introductory speech, so to speak. So maybe before I start, I would like to just inform the people who are viewing us and listening us that me and John are going to introduce in the beginning the joint statement that was just released today, dealing with the topic that I have mentioned, that means the leadership and the need for strong and unified public health workforce. And later on, we will have the representatives from the organizations that I mentioned to reflect on our thoughts and our ideas. But I would like to encourage you all to share your thoughts, questions, remarks, comments in the chat, because we would like to really have this webinar very lively. So this webinar is very unique for me because it is a result of several weeks of discussions with ASPHER, the exchange of ideas, brainstorming and analyzing how did we perform like a public health community, what was wrong, what was good, what could be done better. And as I mentioned, it has resulted in the statement we just released today. And it is also quite unique because with coming together, we wanted to highlight the over 25 years of collaboration between our associations. We believe that to show unity, support, and eagerness to collaborate is now more relevant than ever. The COVID-19 pandemic has exposed the importance of public health leadership. Countries that had strong leadership were better able to design and implement rapid and effective responses that reduce the spread of infection, minimize the impact on lives and economies, and also engaged with the public. We, as public health community, must assume leadership roles. We must be able to keep the pace with rapidly changing knowledge. We must make sure that we have skills and competencies needed to address not just the pandemic, but also the complexities of the communicating of information to policymakers, practitioners, and the public. The coronavirus had shed a new light on scientific evidence and its implementation in policymaking. On the one hand, the scientific consultants and advisory bodies have gained a new level of prominence. On the other hand, tensions between researchers, health experts, and political decision makers have been brought to the forefront. Even in countries where there has been the public health expertise available, governments often did not leverage this expertise to better mitigate trade-offs and guide the policy response in the face of uncertainties. Instead, many governments reverted to a top-down approach to decision-making with political and economic considerations and other contextual factors taking precedence over the research and health directives, further exposing populations to risk. This could have been avoided by building and strengthening knowledge translation platforms, bringing together decision makers, researchers, practitioners, civil society groups, and other relevant stakeholders to facilitate the process of translating evidence into policy and action in responding to pressing issues while taking into consideration the local and political realms. However, when speaking about this, we must also reflect on the context in which the COVID-19 pandemic has emerged, which has been characterized by underinvestment in public health and growing distrust in institutions. For knowledge, as we know, to be accepted and used, it must be trusted and trustworthy. Yet, the pandemic arose at a time when trust in public institutions in many countries was very low. In addition, over recent years, public health has suffered major cuts in funding, partly due to policies pursued in response to the economic crisis, which have reduced the ability of governments to generate sufficient human, physical, and knowledge resources. And this lack of resources has directly impacted on the preparedness and ability of health systems to deliver services. In tandem, public health specialists and experts have been underappreciated and very often even ignored as key partners when decisions have been taken. And this approach is not sustainable. We need long-term investments in people and systems that can meet the growing challenge of public health services. So maybe for me and maybe for many of us, the COVID-19 pandemic has been a wake-up call for better collaboration at the science, policy, and society interface. And this means that we must come together, transcending disciplinary and professional boundaries to find solutions. Public health organizations and workforce remain the backbone of the response to the pandemic and any future health threats. And therefore, they must be empowered to enact effective, agile, and responsive measures. So this is from my side for the beginning. Thank you very much. And John, back to you.
Thank you very much, EPHA, and I can only echo your very wise words and reflections. I'm delighted that we are supporting and working together in this new statement. It reconfirms some of what we see in the EUPHA statement, the EUPHA strategy for 2025, and also in ASPHER's strategy for 2025. So we're coming together in a very meaningful way. In ASPHER's 2025 strategy, you would expect us to be talking about workforce, about curriculum development, competence and professionalisation. And we're also talking about career structures for our young professionals and where they fit in the new post-pandemic world. But we're also in our strategy talking about how our schools behave, how not just what they teach, but how they behave as corporate bodies. Do they contribute to improving climate change? Do they contribute to addressing racism and bad behaviours? And do they support their local communities as major employers and major contributors in the society? I think you'll find reflected in the EUPHA ASPHER statement all of those elements. We're very keen that we develop the next generation of young professionals. We're also very keen that we expand and we make meaningful our international partnerships, not just in Europe, but also on a global basis. The COVID pandemic has shown added impetus for us in that work. We've had many young professionals working in our ASPHER task force, and we've had major development in how we work with young professionals in that. But the pandemic has also shown, as Iveta has suggested, considerable weaknesses in public health and in the health of our public health systems. We see a grotesque inequality in health between rich and poor countries and also within countries, and those inequalities have to be addressed. We've seen a weakness in population health with years of austerity that have damaged the health of our ageing populations and made them more susceptible to pandemic. And we've seen the erosion of public health services and weakening of preparedness. So all of those things need to be addressed. We've also seen heroic action by many of our members, many of our community, and we should celebrate, and we do celebrate in some of ASPHER's papers, the work of schools of public health and the work of colleagues. So we need to be upbeat about what we do in public health. We've seen in the last month the leaders of the world calling for a new pandemic treaty. We've seen the Clark report, the independent panel report on what needs to happen in terms of global public health in the future. But we need some very real and concrete ways of achieving what those aspirations are. Some of those are in governance, some of them are in leadership, but there's also a great need for investment in public health skills, in training, and in developing and respecting that competence and expertise. And we need to work with EUPHA. We look to our partners for advocacy for the investment in the training that needs to happen. And as EPHA has said, it needs to be multidisciplinary. We need to work with international lawyers, with ecologists, with biologists, with theologians, with political scientists, and we need leadership skills and leadership and behavioural science development. So all of these things we can't do ourselves, but we need to make a start with improvement of the technical knowledge of public health specialists and with the leadership skills that we're here reflecting on today. Our statement may be about ASPHER and EUPHA, but I very much hope when we hear contributions from our colleagues in other agencies that you will endorse those sentiments and work with us to achieve what we set out to achieve. Thank you.
Yes, thank you very much, John, for your insightful thoughts. And, you know, your speech actually reminded me of the discussions that we had, because it is so complementary, you know, that we have one direction and you have another direction, and it's beautiful if it comes together. And exactly now I would like to invite our first panelist, Milka Sokolovic, who is the Director General of the European Public Health Alliance. And she will share with us her thoughts on importance of addressing and including of the vulnerable. And she will also tell us more about the EU for Health program. Milka.
Thank you very much, Iveta. And thank you both for your kind invitation to contribute to the closure of the European Public Health Week. It adds a huge value and an excitement to my first weeks as Director General of EPHA. Let me start by agreeing with the notion of importance of joining forces among the civil society organizations operating in the public health arena. The COVID pandemic has been a massive exercise in togetherness. Our countries got together before the EU Health Union was even becoming a reality, allowing for a far superior response to the challenge than we ever could do individually. Our healthcare workers have put their forces together and have given us beyond their maximum. And I would say most importantly, our communities got together, helping each other and supporting the most vulnerable among us. But still, we could do better. Due to their restricted access to basic rights, the COVID-19 crisis has disproportionately hit the vulnerable population groups. And the existing socioeconomic disadvantages have been only exacerbated by the pandemic, leading to the higher mortality rates and risks of complications, emphasizing once again the disastrous impact of health inequalities. And we have failed the communications test, allowing for the vaccine hesitance to flourish amidst the largest health crisis in the century, leading to a sharp drop in trust in governments and healthcare, as Iveta was already suggesting. And we have failed in properly supporting our healthcare workforce in securing their safety, their working conditions, and well-being. And this makes me wonder if more of good stuff is enough And if in addition to working more together, we also need to work differently together. The pandemic has shown that health and public health must be part of the same sentence, as everything boils down to our communities eventually, and hitting hard as the unprivileged, underprivileged among us. And this is where I believe our distinctiveness comes into play and becomes a strength. And this is where the notion of transcending professional boundaries from your joint statement becomes critical. And this is where the interconnection between research, education, and practice becomes an obvious way forward, and thinking out of the box becomes a necessity. And this is, again, where the public health strongholds like EUPHA and ASPHER need a hand of the likes of EPHA, with its membership unique in its diversity. In EPHA, we filter the specific perspectives of healthcare professionals and patients on the one hand, but also of other public health stakeholders, especially of the vulnerable groups, directly from the ground, and we transform them into rich new ideas and advocacy. And by putting together our distinctiveness, we can not only highlight the importance, but actually impact the education and skills of the workforce, as John was saying, from bringing health inequalities into medical curricula to training public health experts in skills and competencies that are necessary to secure their leadership and ensure impact of their work. And I'm talking about new skills like advocacy training and political and networking skills, those that are necessary for the transmission from evidence to practice, and that we, by the way, have in our portfolio, and we are happy to offer. On the other hand, by working together, in order to rebuild trust and reach the vulnerable, we can bring communication to both policymakers and general public to whole new levels. And as John was already suggesting, these are not the only boundaries we need transcending. There are other pots of knowledge that we must be tapping into, from psychology and behavior over environmental to humanistic to economic and technical sciences, to detangle that complex social determinants bundle of health and bridge the health gap between the most and the least fortunate in our society. So going forward, tackling health inequalities one of the top political priorities of the European Health Union is a key prerequisite for achieving its main aims. So for reinforcing health systems, ensuring their resilience, and building the EU preparedness for upcoming health crises. NGOs can and will play a vital role in this critical work and will help member states to deliver on urgent health priorities. But for this, we need sustainable support from the EU4Health program so that we can remain largely independent and continue working as a credible and reliable partner. And as opposed to acting ad hoc in an opportunistic and competitive manner, such structural support from the EU4Health program will allow us to remain flexible and collaborative while remaining strategic and while being free to adjust to the public health challenges as they arrive. That's it from me. Thank you. And back to you, John and Iveta.
Thank you, Milka. And now it's my great pleasure to introduce Natasha Azzopardi Muscat from the World Health Organization. Natasha, you're very welcome. Do give us the benefit of your great wisdom and experience in many European roles and now with WHO. Thank you.
Thank you very much, John, for your kind words. I hope you can hear me well. And good to see you, Iveta. And it's really a pleasure for me to be asked to represent WHO Euro at this closing event of the European Public Health Week, an event that is, of course, very close to my heart. And we've been talking a lot about public health leadership, but you have given me an opportunity, even through your statement, to really reflect some more about what do we mean when we talk about a strong and united public health workforce. And I think EPHA and John, you set out very, very nicely where public health and the workforce was at the start of this pandemic. We had many studies that had shown that public health services were under-resourced, under-invested, and in some countries were really pushed to the periphery, so to say. So I think we started on a rather fragile footing in some senses. But what have we seen? I think in the past year, what we have seen is that the public health workforce became very united in scope and purpose, with many countries having practically repurposed their entire workforce to the COVID effort. And I talk about the COVID effort here in a broad sense, because there was just so much to do. It was, yes, of course, about scaling up testing, contact tracing, surveillance, but it was also for our colleagues working in digital health to set up the solutions, for our colleagues working in mental health to reach out to the clinicians to set up helplines, for our colleagues working in health services management to try to come up with solutions to keep essential health services going when everything else was closing down. So I think it gave very much the public health workforce a common sense of purpose, not to talk about other colleagues who perhaps we interact with a bit less frequently, such as the lawyers and the ethicists, and we did have several pressing problems to deal with that really required us to draw upon the expertise of those colleagues too. The second point is that in some countries, public health over the past years had become increasingly isolated from the clinical health workforce. And let's always keep in mind that no matter how strong and united we are as a public health workforce, we remain very small, whilst there is a huge and powerful health workforce out there that we need to engage far more closely and strongly with. I think over the past year, we have seen how we have been able, through our efforts, to reach out and support our clinical colleagues. When our clinical colleagues were drowning in ITUs, in A&Es, on hospital wards, it was the strong advocacy from public health leaders to bring about certain measures which were often resisted and seen as unpopular that helped our clinical colleagues to be able to reduce hospitalizations and to cope with the workload. And I think the strong linkages between public health decisions and the impact on health services, COVID made these more visible, more instantaneous. Of course, if less people smoke, this impacts also our colleagues working in hospitals and primary care. But sometimes those effects are less visible and take time. Whilst with COVID, we were really able to show that public health measures make a difference to our colleagues in the health services and that we really need to be working more closely hand in hand. The third point is about working with other sectors. Whilst we have spent so many years knocking on the doors of trade, of tourism, of schools, we suddenly found ourselves in a situation where everybody was knocking on our doors. Again, there have been fraught and tense and difficult moments and lots of negotiations. But I hope that the legacy will be that relationships have been built, that common language and common understanding has been brokered, and that we don't, now that we start slowly, perhaps in some countries where vaccination rates are going up, beginning to put the acuteness of the COVID pandemic behind us in some countries in Europe, that we forget about these important links that have been forged in times of adversity as we go forward, and we use them now to rebuild what needs to be done to make a difference. And my fourth point is about unity. In many countries, public health leaders were really under the spotlight and were often very much criticized. It's in such situations that you need the unity of the European and international community together to stand strongly together. And this is where organizations like EUPHA, EPHA, ASPHER, of course, supported by WHO European Commission, where we have to step up, step forward and play a role. Looking forward, our skill sets are going to be tested to the extreme, even if we manage to put COVID in its acute form behind us, as we have huge economic and societal implications still to deal with, not to talk about, for example, NCDs. And for over here, WHO in the area of mental health is now going to establish a coalition. Why? Not only to bring together the trusted partners, but to go beyond and engage with new sectors and new partners. There is a moment of opportunity to do this, and we should not lose it. What are we doing? We have asked you, we have reached out, and you have kindly come on board. We are trying to hold a mirror to ourselves as public health professionals. And we are trying to say, are we still fit for purpose? How do we need to change to be more fit for purpose to deal with this new world that we find ourselves in? A world which is in a digital era, a world which is in an infodemic era, a world where societies are increasingly fractured and there is no one-size-fits-all solution. And we're carrying out a study, and we hope to be able to launch the results at the European Public Health Conference in autumn this year. That will only be the starting point, and together we will then continue to work to build the competencies, skills, and leadership profiles that we need. And here, and this is my final point, as WHO Euro, we are also investing in building the next generation, and we are building also a leadership and academy profile, particularly concentrating on young professionals in those countries where the public health workforce is still not yet sufficiently developed. Over, back to you.
Thanks a lot, Natasha, for sharing your wisdom, as John has anticipated. We feel so privileged to have you as past president of the EUPHA, and we are also very grateful for your continuous support. So it's always so nice to see you around, Natasha. And last but not least, I would like to now welcome our third speaker, Isabel de la Mata, the Principal Advisor for Health and Crisis Management from the European Commission, DG Health and Food Safety. She's going to be the last speaker, but definitely not the least. And we very appreciate very much also her wisdom and her insightful thoughts on, on various public health issues. Isabel? I think we lost Isabel. Can the EUPHA admin do something about that? Okay, so maybe it will be a bit more tricky. So I would like to just ask maybe John then to come with the final summary because of the time pressure. So I believe that with Isabel, we are going to have some additional communication and collaboration, and we will share the thoughts also with you as the attendees of this event. So John, back to you.
Thank you very much, Iveta. It's a great shame we can't hear from Isabel, but clearly we are looking to our partners in the European Commission and the European Union to make reality out of some of the aspirations that we've talked about today. And we very much look to a coalition of partners to be able to make the desire for better health a reality and for better preparedness. We don't want to see this prediction of the era of pandemics. We want to see planning for an outbreak of health. And it seems to me we've heard from Milka and from Natasha a great desire for us to be united and to be effective in impressing upon political leaders how we need to see better health and how it needs to be valued to a much greater degree than it has in the past. So with that, I would like to thank all the participants. We are over time. We will pursue with Isabel the issues that we've been raising, and thank you to everybody who's been on the call, and we look forward to working with you. EPHA, would you like a last word?
No, John, I think everything has been already said, so I just would like to wish the participants of the European Public Health Week to enjoy the rest of the event. Well, we have Isabel back, so I'm not sure. We already made the conclusion, Isabel, but I think it would be nice and polite to give you maybe 1 or 2 minutes to reflect very briefly when we fortunately have you back.
Sorry, very short. I'm not at the office. I'm with family issues, but I wanted to be present here. And the only thing that I want to say is that this year has been very difficult for everybody, but has shown also that we are able to show solidarity, to work together, and that we have demonstrated that working together, that pays. I think that has been important also for public health, because and for public health professionals. I don't know that if the population understand what we do, but they know at least that we exist, and now everybody knows that the epidemiologists exist, that public health professionals exist, and that they are working in something related to at least communicable diseases, but also on prevention and promotion and things like that. So now is our work to make this understandable for everybody, to do a good communication, to pass in a better way the messages that are important on public health and that are important on our work, and that health is not just about cure, about treatment, but it's also about the prevention and the promotion. And one of the good news for us and in the European Union is that the EU for Health program that has been mentioned, and that is very important and completely different to previous year. The steering group meeting took place yesterday, paving the way for the approval of the work program 2021, that probably on the 9th of June, when the committee of the program will meet. So I think that this is also important. The program is well dedicated to prevention, is well dedicated to preparedness, and we hope that the lessons that we have learned from this pandemic will help us in the future to do better things and to do everything in a better way. So we need to work with our health professionals, and we need to work with all the stakeholders that are around in Europe and that are important for health. So very short, thank you very much, and very happy to be here with you.
Wow, Isabel, it is so good that you managed to come back, because we would definitely miss your insights, and your comments and everything what you have just said. And also we would like to thank you once again, also to you specifically, Isabel, for collaborating us already for many years during the European Public Health Conference, and also here during the European Public Health Week. So we are absolutely grateful. So once again, I would like to extend my big gratitude to all our partners, and also the WHO, John, Milka, other partners, other stakeholders from the European public health community, so to speak. We are looking forward very much to collaborate with you, and we are not the exclusive club, but actually we are very inclusive, and we like to collaborate with many people. So once again, thanks a lot. And in the chat, you also have information about the other events that are still going on today. This is it from my side, and well, wishing you a lovely day. Bye.